Okay, hi, I'm Jill. My topic today is going to be on ear cupping on dogs. My main claim is that it's an unnecessary procedure that's performed. In case you don't know what it is, it's a surgical procedure, and it basically cuts off 70% of the ears on dogs so that they stand in an upright position. My three main claims are that it produces harm for dogs, it has zero medical benefits, and is opposed by major animal organizations. Basically, the main harm is in any surgery that you perform on dogs, but this isn't a necessary procedure because it's only needed for cosmetic purposes. The surgery itself has its risks in anesthesia in case the dog is allergic. They can go into shock. But other than that, the surgery went okay. There's the aftermath of the surgery, which includes infection, open wounds, and it's an extremely painful situation for the dog. Pain medication is provided, however, just like humans, only a certain amount can be given to the dog before they overdose, and even the medication is not enough to keep the dog comfortable. It is an overnight procedure. The dog stays in the hospital, so it causes even more stress on the dog. Multiple procedures usually have to be done because so much of the ear is taken off. The ears don't stay up by themselves. A lot of times it's not perfect in the first surgery, so multiple surgeries are needed. And also the dog's ears have to be taped, so you have to retape it multiple times. I work at a pet hospital, and we have a dog come in at least once a week for retaping, so it's really painful for the dog. Also, the ear has to be sutured, and there's nerve endings in the dog's ears, so it makes it bleed even more. Another harm for the dogs, a lot of people don't know, is that dogs use their ears to show emotion. So when the ears are cut off and put in an upright position, they are unable to show their emotion towards other dogs and also humans. My second point is that it has zero medical benefits. Some people say that it prevents the dogs from getting ear infections because it allows the air to flow through the ears. However, taking off 70% of the dog's ears leaves the ear vulnerable, and the eardrums can get water inside. It can cause even more infection than if the ear had air flowing through it. It's only seen as traditional. It's usually done on breeds such as boxers, Dobermans, pinchers, and pit bulls. Their ears are in an upright position, which sees the dog as tougher, and so it's only for cosmetic purposes, not for a medical purpose. It's opposed by major organizations such as AVMA, and they came out with a statement that said, for many years, the AVMA has acknowledged that ear cropping and tail docking for dogs is thought for cosmetic purposes and not medically indicated nor benefit our canine patients. And that's by Dr. Haven, a member of the AVMA, which is the American Veterinary Medical Association, and also the AAHA, which is the American Animal Hospital Association, gave the quote of, ear cropping in dogs is for cosmetic reasons and is not medically indicated nor benefit of the patient. These procedures cause pain and distress, as well with all surgical procedures. They're accompanied by inherited risk of anesthesia, blood loss, and infection. Therefore, veterinarians should counsel dog owners about these matters before agreeing to perform these surgeries. So again, there causes harm to the dog, there's no medical benefit, and most owners should do research if they do decide to do it.
All right, well, you ID the subject clearly. The proposition is kind of buried in the introduction, but the secondary issues are outlined for us pretty clearly, and you do a good job signposting them as you go through the speech. I thought that your proof on the first point is really non-existent. You just have a description of what the procedure is and a personal evaluation of it. at most we have something that says that there is some risk because anytime you have surgery there's risk, and that there is pain, but and there's even an assertion that there's a problem with managing the pain, but I don't get any, I have no statistical data on this, I have no authority that's telling me this. This is all an assumption that you're putting into the presentation. When you say it's unnecessary, you need to specify that it's unnecessary for any medical or safety issue for the dog. When it comes to it being cosmetic, well, a lot of people would say cosmetically something's necessary. For instance, you talk about it's all appearance. Well, if you have a purebred dog that is supposed to look a certain way and you're showing them, they might need that kind of thing. It's certainly not medically indicated like the two people that you quoted suggested and the board suggests, but that doesn't necessarily mean that there's something problematic with it. The stuff about there being a potential problem from ear infections and other issues, I think that that's probably pretty believable, but we don't have any statistics on it. If most surgeries don't end up with any kind of infection, why would this surgery end up with any kind of infection in any greater amount? And even if it is a certain percentage, let's say it's 0.5% of, or maybe it's more than that, maybe it's 5% of all surgeries end up with some kind of infection, and we're just going to make the generalization that that would apply to these infections as well. All right, then 5% of them that get the ears cropped have the infections. By the way, what's the problem with the infections? Aren't they cleared up usually after a period of time? If you've got examples of dogs that have to be destroyed, for instance, because they can never get out of this or because they've had too much surgery and it's created a problem for them, I think those would be good points for you to add in the argument. It just seems kind of, I mean, you basically say it's not medically indicated, and those are the two board quotes that you have, and I don't think anybody is disputing that. So the dispute is whether or not there's a harm that occurs from that. I think you need a little bit more information on that. All right, that's it. The only other thing, completely separate from that, I seem to remember